Well, the $52.8 million will be used to increase emergency retrievals of unwell patients in rural and remote areas by up to 50%. Some of the funding will also be used to transport medical professionals into those remote areas if an outbreak of COVID-19 occurs, and also to help move medical supplies around the country. Now, there are some 7 million Australians who live in rural and remote parts of Australia, and at least 500,000 of them live in very remote areas. While the infection rates of coronavirus have been relatively low in those remote areas, the Federal Regional Health Minister says the risk is still there and that he wants to ensure there is the same level of safety applied right across the country. Now, so far during this pandemic, the Royal Flying Doctor Service has transported at least 170 patients who have tested positive to COVID-19 or were suspected of having the illness. The company as well, Tom, has also had to change the way that they operate to protect both the aircrew and patients.
So we literally have to decontaminate aircraft and the transportation in between the aircraft for every passenger. You'll also appreciate that the space available in the back of aircraft for both crew and patients does require a heightened degree of personal protection and infection control. So all of that requires time, preparation, planning, but importantly equipment.
And it's only appropriate that at a time of need like this that the Australian Government would go to their long-time partner, the Royal Flying Doctor Service, to ask them to step up and increase their capacity.
Tom, some of the funding will also go to Care Flight in the Northern Territory and other aeromedical departments around the country to help provide more evacuations if need be.